In general, lots of people like talking about the ailments within our communities. It's talking about them in the correct way, and you can talk to them about you can talk about your conditions to anyone. You know, there's no stopping. I think what's really important is to remember that the difference between a view on a condition or a treatment versus the correct information. So there's no problem talking about it. It's just making sure that the information, the advice that you're taking on, and if you're not sure, then speak to your healthcare professional about it. Speak to the nurse at the regular checks that you're doing. Some people are maybe less likely to because they're worried about talking about it. And we really need to normalise talking about diabetes, talking about our conditions, because why should we worry? You know, there is no specific worry. By talking about it, you're not going to spread it. By talking about it, you may help someone else that may be struggling, or actually what we need to remember is diabetes, if it's controlled well, hopefully you can have a long and healthy life, okay? Diabetes is part of our life, and we need to remember that you can continue to lead a very normal life with diabetes. Some people really, really struggle, and that may mean that they may not be able to control their sugars, and they're running into risks of losing their sight, kidney damage, or even amputation, so losing their toes, feet, legs. And by talking about it, it may help that person to give them that confidence to say, if they can manage, I can manage. So that's why it's really important that talk about it in the right way with the right information, but know that you may really be helping someone else as well. Some people may find it difficult talking to their healthcare professional about their diabetes because there's lots and lots of questions. As we said, diabetes is a part of life, okay? So you have to live with your diabetes. What does that mean? It can affect your work, your driving, your food, your social interactions, having children. It can affect everything. That means that you may have questions about everything. Yes, you can come and speak to your healthcare professionals about everything. We may not be able to answer everything in one go, but it may be giving you the resources and showing you where to find all the information that you need, and then keep coming back, have that dialogue with us, with the practice nurses, with your diabetic specialist to get those questions answered. And I think it's really important that every time you think, every few months, you may think of new questions. Keep having that open dialogue. It's really important, and that's going to help us work together as a team to manage your diabetes. The other thing is that some people struggle and they worry because maybe English isn't their first language. We have lots of different languages within our communities: Bangla, Urdu, Punjabi, Hindi, lots of different languages, which is wonderful. Please don't feel that that should be a barrier. Of course, it does make things a little bit more difficult, but we have access to interpreters. Like we said, we've got resources, written and videos in different languages via this website called Diabetes UK, but also we can access interpreters, we can give extra time. So you can also bring in maybe a family member who may be able to help understand, and that means that they're included in that management plan and can help you understand through things. And lots of places you can get that extra time, or we can book you in for maybe multiple appointments to make sure we're getting those questions addressed. So it may feel a bit difficult with your healthcare professionals if you specifically don't speak English as a first language, but that doesn't mean that you can't get the help. You most definitely can. We talked about how to have those conversations with friends and family. Then the questions really then is, how do you even start that conversation? We talked about what to talk about, but not necessarily maybe how to start those conversations. I think it's really important just to think there is no right way. Just go in and talk about it. If you've spoken to your healthcare professional and you and the healthcare professional have both decided that you're diabetic, or you may be pre-diabetic, or we're worried about diabetes, you will understand that hopefully from the consultation that you have. So when you take it back to your loved ones, your family and friends, hopefully you can explain to them what you're feeling. And if they want to support you, then they will be supportive. If there are issues or maybe negative things being said, maybe try and understand what their worries are. I appreciate that you're the one that's been diagnosed, and it may be that that other person is scared or worried or actually got the misinformation. So hopefully when you've spoken to your healthcare professional, you'll know where to access the correct information, and also family and friends can also access that correct information, so they can then maybe learn about diabetes and that misinformation can be cleared up with the right information. So essentially, just open up and have those conversations. Maybe they'll come up with lots of useful information, and actually you may be surprised. They may be really, really supportive, and maybe look at, you know, how you can all lead a healthier life, because essentially one of the starting blocks is leading a healthy life. So exercise is great for absolutely everybody in the family. Eating healthy is a necessity for everybody in the family. So it doesn't mean that your whole life needs to completely change. It could be things that you do together, which is also positive for everybody. We talked about lots of people feeling a bit worried about what someone else will think, or the stigma attached to diabetes. If you're feeling worried and you're thinking, what other people are going to think? Can I speak to anybody about this? Maybe come and speak to us about what your actual worries are and your concerns are, because it may be things that have been misled, or that misinformation that we talked about. So it may be things that are actually completely incorrect. I've talked about the fact that some people think diabetes just means insulin straight away, and insulin equals an amputation. So actually it may be that somebody is really worried about that, or also really worried that maybe they can't have children, and that's not the case, okay? Diabetes is a condition that you have to live with, and it's a condition that is associated to lots of risks, but if you manage it well, then hopefully you reduce those risks massively, and hopefully that means living a very healthy and settled life, and being able to have children and not struggle with things like amputations. So come to speak to your healthcare professionals if you're really struggling with that stigma. We do know that chronic conditions such as diabetes are associated with mental health conditions, such as may lead you to feel more depressed or stressed, or struggle with a bit of anxiety. So again, come and speak to us, because there's lots available to help. Maybe we can always speak through what your worries are with your family as well, and they're welcome to join in the consultations as long as you're happy for them to, and maybe we can address the questions and worries that way as well. Lots of people are worried about talking to their employer or the people that they work with about the fact that they have diabetes. Now, there are a few circumstances where you need to notify who you're working with or what you're doing. For example, if you are a HGV driver, a bus driver, those kind of jobs, that does directly impact whether you have diabetes and what you need to do for those things. But parking that, because that should be discussed in detail with your healthcare professional. Apart from that, though, lots of people worry about, should I tell my employer? What would they think? There should be absolutely no reason why you can't tell your employer. Hopefully your diabetes is well managed, and even if it's not, it means that they're aware that if you are feeling unwell, that they can notice those signs and signals, and it means that everyone can maybe work together to help support you in your diabetes, in your journey with your diabetes. But essentially, if you have diabetes, it's really important. The main thing that I'd like to say is it doesn't mean that you can't have a normal life. So you can uphold any job pretty much, apart from the ones that that I started with talking about. Those may need some further conversations, but it shouldn't affect what you can do, your outcomes, your productivity, and it most definitely should not affect whether you can get a job or not, or whether you're allowed to stay in a job or not. If you're someone who struggles to maybe open up about your condition, such as your diabetes, it may be good to think about why you're struggling, or are you actually struggling? Or maybe those questions hadn't come to your mind. Your appointments with us as your general practitioners and the practice nurses, as well as if the diabetes teams are involved, will be very informative. You will be told about lots of different things and given that signposting advice to Diabetes UK and other great organisations and websites for lots of information. So if you're struggling to ask about things, maybe book that appointment, and ways that you can communicate with us are maybe writing down a list. Maybe you're forgetting what to ask because there's so many different things and you're getting overwhelmed, and that's fine. Write it down as a list as you go along. Book that appointment in a month or two with us, and then we can go through the lists. Or if you just don't know where to start and you're just struggling but you don't know how to even start that conversation or what exactly you're struggling with, come and tell us. I know it's easier said than done, but come and speak to us and just say, I'm struggling with my diabetes. I don't know why, but I'm struggling, and that's absolutely fine. That's what we're here for. Come and have those conversations with us, the practice nurse, whoever you feel comfortable with, and hopefully with your GPs and your family doctors, what that means is you are seeing us regularly, so there is some familiarity. Come and have a chat to us, and then hopefully we can overcome those barriers together. The South Asian community has, I personally think, one of the richest diets in the world. You know, it covers lots of different types of fish. So we're not just 3 or 4 fishes, we're talking about fishes that I don't know the words in English for. Lots and lots of different types. We cook different meats in different ways: lamb, chicken, beef. There's lots of different ways to cook rice. You know, it's amazing. And the other thing is there's lots of different ways to cook vegetables, and there's loads of different vegetables that I couldn't find in the usual traditional supermarkets, that I can only get when I'm back home. I have, again, no idea what they're called in English. So it can be difficult when you're at a family gathering or maybe a wedding, or you've been invited to somebody's house and they've cooked this huge, lovely spread of food. It's really important to just think about your diet. Sometimes it will be that maybe that's a little bit of a treat day, depending on how well your diabetes is managed. And sometimes it may be looking at exactly what food is on the table. If you feel worried that maybe the host may feel offended because you're not eating the food, you know, talk to them, tell them that, you know, you've got diabetes and it affects your sugars and that can make you really poorly. And hopefully then there will be no force feeding, which again is one of the ups and downs of our culture. But maybe then they can understand why you can't maybe eat everything on the table. But have a look at what's on the table. There may be some pilaus, biryanis, but there also may be brown rice or white rice. So just looking at the selection, it may be that maybe choose the brown rice. If you're going to go for the curries, there's no problem in picking out the fish from the fish curries, or sticking to the chicken rather than maybe the red meat, and picking it out and maybe not taking too much of the oily sauce, those kind of things. So there are definitely ways around it where it doesn't mean that you don't get to eat, or that it's highlighted that you are not eating, or somebody may get offended. Maybe just have that discussion and say, I apologise, I'm not going to be able to eat X, Y, and Z, but I can try these things. It's also maybe that you're not picking out lots and lots of the carbs, that you're focusing on the proteins and the vegetables, and that's great. I think one of the other difficulties is we have lots of different variation of sweets, and that's probably a little bit more difficult to manage which ones you can pick out. So if your host maybe already knows that you're diabetic, maybe they can tailor those sweets to maybe less sweet or sweeteners. But if they can't, or they're not able to, which is also understandable, it's just having those discussions that you can maybe eat them, but they're in moderation. So instead of eating that kheer, which is the rice pudding, or the gulab jamun, or the laddus, instead of eating all of it, maybe just pick 1 or 2, or instead of having 3 of each thing, maybe 1 or half of each, so you get a taste of it. It's just important that you're aware of what your sugars are day to day, so you're going to know before you're invited what your sugars are doing. So if you think that within your control you can eat that in moderation, great. But equally, if you think, you know, you're on insulin, you're checking those sugars very regularly, and you know it's going to have a direct, very quick negative impact, you know, speak to the host. And again, everything in moderation is key. In our communities, we are very selfless, especially the women. It's often viewed that, you know, taking time out for yourself, and I think not even in our communities, you know, in all communities, in all walks of life, often a lot of people think taking that time out for self-care is something that's very selfish, because, you know, you've got things to do, you know, you've got to go to work, you've got to see to the kids, you've got to make dinner, you know, life is really, really busy, and taking that time out for yourself can often be viewed as quite selfish. And that's not just what outside people think, maybe what you think as well for yourself. And it's really important to say, okay, why do you need to exercise? You exercise to be healthy, and you're exercising to try and live a long and healthier life, and to control, if you've got chronic conditions such as diabetes, to manage that diabetes. Why do you want to manage that diabetes? It's so you can have a long and healthy life, so you can be present for your children, for your family, for your husband, for your wife, for your parents, for your friends, and do those activities and have that job and do those things that you love. So I think it's just changing that mindset completely to exercise is to help your condition, i.e. your diabetes in this case. So just like you're taking those medications, We talked about exercise, diet being a form of treatment for diabetes. So taking that time out is going to positively impact your condition and hopefully help you or be a factor to you living a good and healthy life, so you can be there more for your children, more for your family, your friends, your loved ones. So shifting that mindset is really, really important, that doing exercise is not selfish, it's self-care, which means you're managing your condition better, and hopefully then that has a huge positive impact to you in your life and those around you.